daunted by it because computerisation in aged care is at its start. However, the results over the last 6 months have been superb. The clinical software has made a big difference to the way that our carers actually record information, access information, and at the end of the day reduces the time they're spending on paperwork, which means that they're spending more time with the residents. So for me, the project has been a huge success.
Bye. I just need to take your blood pressure, okay?
Yes, good.
Thanks, darling.
Thank you.
Hello, Vi. Morning. Hi, Dill.
Hi, Christine. How are you?
Good. How's it going?
Good. I'm just about to take Vi's blood pressure.
How are you finding recording into the C5?
Oh, look, I find it a lot easier.
Is it?
Well, I can enter everything in one go. I'm not going to different charts. I can do a blood pressure, I can pulse, I can compare it with previous readings.
Fantastic.
I can go to numerous patients with the trolley and do temperatures, blood sugars, whatever I want with the one
Sounds good,
trolley.
doesn't it, Vi? That's fantastic.
Collecting that information quickly and easily means that they're not having to spend as much time in that administration. They can actually spend a lot more time in the one-to-one contact with the residents.
The other sorts of things that we've been doing is offering access to the internet that we couldn't do very well before, and we've got people in the facility that used to be very reclusive that are now actually coming out and acting as mentors to other residents, showing them how to use email, showing them how to use Google Maps, and again it's breaking down that shut-in feeling, using the technology to show them that they're still part of the world, and they're enjoying it immensely.
They can do Skype with their families, so we've now got a program in place where we're linking in through Skype into speak with their family member who they can't get to visit very frequently. So it's made a big difference to them to know that that access is there for them.
You know, we've got a lady living here that's talking to a family in Townsville.
Very rewarding. I enjoy the family contact. It's very different than a phone call, and for the sake of the grandsons, only being 4 and 2, it's fantastic to see the changing in them.
It totally lifts their spirits to be able to keep in contact with the family that they now can't be with. But it's not even so much for the residents, it's also fantastic for the family, for them to be able to keep in contact. I think they get more of a thrill out of it than our residents do.
If we didn't have Skype, she would only get to see them twice a year.
Yes.
And when there's grandchildren that are so young.
It's changed my life, it really has.
One of my reservations was that the staff were going to be reticent. They were going to find it very difficult to move to the technology.
Initially we thought, oh my goodness, how are we going to cope with this? But once it was set up for us, it just simply took off. And all of our team, they've just really all taken it on board. And I'm quite proud of what they've been able to do.
The collaboration between the staff members has been apparent. You can see them all talking to each other and sort of problem solving and what have you learnt, and so they're sharing that information. So it's raised the game generally across the board.
It is quite satisfying to see that we have broken the technology barrier, getting people who have feared technology for a lifetime engaging with this technology and having fun with it.
Oh, for people who do not have this system at their facility, I would say have a look at it and welcome the change and get on board.
To actually have to find the capital, the training time, the resources that would be needed to implement something like this, it's a very, very big ask.
We could have done something like this, nowhere near to the level, but it's that safety net that we've got, the backup in ensuring that, you know, all of our information being held off-site, being held on servers in Sydney, all of that is in a secure environment that we don't have to worry about any of that side of things. It's actually handled for us completely.
I can't speak highly enough of the support that we had. I know even during the evening, if on an evening shift on a weekend, if we sent an email off with a request, we got an answer very quick.
I think that the true success of the project has been that a third party using the Connect Care model can actually coordinate for a small facility the sort of resources and skills that are needed to make the implementation seamless and easy for the staff, and at the end of the day bring it in as cost effectively as possible.
Well, the biggest thing, I suppose, is that our facility is now taken a great leap into the use of technology. You know, we came from basically no technology in the place to a great setup that's a big advantage for us.
I think it's beyond our expectation. I'm really not sure we had conceptualised what it was going to do for the organisation, and in particular for what care the residents ultimately benefit.
If I went to a new facility which was paper-based, I would think, oh gosh, they need to come on and move with the times, because now we've started using it. I never want to go back.
Wouldn't go back. Wonder how we did it. Look back and think, oh, glad we aren't there anymore.
Well, I think the proof's in the pudding. When you can have a look, you can walk into the environment here and you can see what our staff can now do with the technology. It actually allows us to provide that greater level of care for the residents.
Sister Georgina from St Dominic's Hostel in Blacktown, New South Wales, a 50-bed low-care facility. At this facility, we would need to access the online for better residence management, and we find that at some stage we have more than one person using the system. We do not have IT expertise on the hostel, so we turned to Eaton Group, who attend to our system at their data center. We've already had 3 years contract with Eaton Group, and although we had access to the help desk, we never needed to use them. So we are about to make another contract for the next 3 years because it just simply works. We require access to our critical care application, iCare, 24/7, which sometimes we have several users at any one time.